Ladies and gentlemen, welcome to another video of me talking about things I want to talk about, and this time let me take you to the hospital. I'd like to share some basic general information I feel like everybody should know so we can all have a bit of an understanding. I'll talk to you about types of diseases, forms of medication. I will let you know what are the most common used tools and devices. I will also briefly explain the diagnostic and supportive specialties. And before that, I will start with the four main categories of specialties so you know who treats what. I've been going for quite some time now, and I've been asked multiple times whether I was a medical professional or student. Clearly I'm not, but that's probably because I'm familiar with medical terms. And if you're wondering how do I know that, it's because I pay close attention to what's being said and done around me. But also I was interested in becoming a medical translator, still am, was seriously studying and prepping for it. Didn't work out, but here we are. To begin with, you need to understand there are four main categories of specialties. There is primary care and generalists. There's internal medicine and subspecialties that are non-surgical. And then we have surgical, and finally we have diagnostic and support specialties that I mentioned earlier. You're gonna notice all the specialties have something in common at the end of each word or at the end of each name, and that's the suffix ology, and it means the study of something. It originated from the Greek word logia and is derived from logos, which means reason. All right. If it has to do with your brain, spinal cord, or nerves, you need to see a neurologist, and that's neurology. But if it has to do with your mental health or emotions or behaviors, you need to see a psychiatrist. If you have an infant or child or an adolescent at home, if they're not feeling well, you need to take them to a pediatrician, and that's pediatrics. And if you or a friend or a loved one who's an adult is not feeling well, you can take them to see an internal medicine specialist. Now, if they're a bit older, 50s, 60s and above, that's geriatrics. And if it has to do with blood, that's hematology. And if physical rehabilitation is required, that's physiotherapy. For the rest of the specialties, I'm gonna start here and work my way down. If it has to do with your eyesight and vision, you need to see an ophthalmologist, and that's ophthalmology. If it has to do with your ears, nose, and throat, ENT, you need to see an otolaryngology. For your teeth, you see a dentist, and for your skin, you see a dermatologist. Moving forward, if it has to do with your vascular system or heart, you need to see a cardiologist, and that's cardiology. If it has to do with your lungs or respiratory system, that's pulmonology. Moving to your digestive system, if there's something wrong with it, we need the department of gastroenterology. Hope I didn't butcher it. And for kidney function or kidney diseases, that's nephrology. If it has to do with your musculoskeletal system, and that's your bones, joints, ligaments, and tendons, that has to do with orthopedic. In all these specialties, there's no difference whether you are a male or female patient, and you can either be seen by a male or female doctor. However, for the following two, it matters, or there's a difference because it has to do with our reproductive organs. If it has to do with your urinary tract and male reproductive organs, that's urology. So you need to see a urologist. But if it has to do with women reproductive health and organs, or pregnancy and birth, that's OBGYN, which stands for obstetrics and gynecology. We have three more specialties to go. So for cancer, we have oncology. You need to see an oncologist. And if it has to do with autoimmune diseases, arthritis, and joint diseases, that's rheumatology. And finally, for our endocrine system, hormones and metabolic disorders, we need to see an endocrinologist. Following the video plan in this part, I'm going to talk about the main four categories or types of diseases. To begin with, we have infectious diseases. And these have to do with viruses, bacteria, fungi, and parasites. The second type is deficiency. If your body lacks something, it could lead to a disease. And the third type is hereditary, which means genetic. That means something has been passed down to you from one or both your parents. But I need to clarify with genetics, sometimes there could be an abnormal mutation that has nothing to do with it being hereditary. And the last one is physiological, non-infectious, and this one has 3 subcategories. It could do with your lifestyle, autoimmune, or degenerative disease where your organs function deteriorate. For the third part of our video, I'm going to tell you about the different forms of medication. There are 7, however, I only know 6. The first type is liquid, IV, syrup, or you can get it through an injection. The second type could be tablets or capsules, and the third could be a cream or an ointment that you use and apply externally or internally. The fourth type is inhalers and puffers. The following one could be a patch that you stick on top of whatever it is that you have. And the last type that I know of is surgery. Sometimes you could require surgery. Now there's minor and there's major surgery where they could fix something, remove something, or implant something in your body. So far, we've covered the main specialties, the different types of diseases, and the different forms of medication. And in this part, I'm gonna talk to you about the different tools and devices used mostly in the ER or during medical appointments. To begin with, an injection. And that is either used to collect blood or give you a medication like we just mentioned. The following device would be a vein viewer, and that is usually used to help the lab tech or the nurse see your vein if they can't get any while they're trying to collect blood. The following device is the blood pressure monitor, and that is used to monitor your blood pressure. Now, a normal healthy range or level could be between 120 and 80. You can increase 20 or drop 20 and you'd still be good. And next we have the glucometer, and that's used for checking your blood sugar level. Gluco means sugar. And a normal healthy range is between 70 and 99. There's a small device usually placed in one of your fingers, mostly the index, and that is called a pulse oximeter, and that's used to check your oxygen saturation. And the normal healthy range is usually between 95 to 100. In case further investigation is required and they need to get a sample from you other than blood, you would usually receive a specimen container or a specimen cup, and that is used to safely collect, store, and transport biological samples, and that could be saliva, urine, and stool or tissue. You might also see an infusion pump, and that's used to deliver fluids in precise amounts, and you might also see a suction device, and that's used to clear the airway of any blood or mucus or any obstructions on the way. And the last 2 devices are a ventilator, and that is used to provide automated mechanical respiratory support. If you can't breathe, they use a ventilator. And the last one is AED, which stands for automated external defibrillator, and that's used to monitor the heart and provide electric shock to restore heartbeat during cardiac arrest. This is the last part. We're almost done. I'm going to tell you about the 3 diagnostic and support specialties. We have emergency medicine, we have radiology, and anesthesiology. Now, the anesthesia specialist is responsible for pain relief and making sure that the patient is sedated during surgery. As for radiology, they do images, X-ray, CT, and MRI. The last one is emergency medicine. They are responsible for triage, diagnosis, and they provide acute stabilization if immediate medical attention is required. And that's it. We're done. Thank you for watching.